Welcome to Physiology 1. As we begin this journey together, I want to set clear expectations for how you should approach your studies. This course is about clinical physiology, so your focus should be on understanding concepts that have direct clinical applications rather than memorizing every detail. Here's what I mean. Consider a patient presenting with muscle weakness. To understand the cause, we might ask questions and perform examinations that guide us towards a diagnosis. Testing for strength helps assess the severity of weakness. Unilateral versus bilateral findings or symmetric versus asymmetric findings give us clues about the underlying issue. Reflexes can indicate whether there's an interruption in the neural circuit or a possible brain lesion. From there, we might perform tests like electromyography, muscle biopsy, nerve conduction studies, MRI, CT scans, or blood tests looking for muscle damage markers. Each test contributes to diagnosing the condition, guiding treatment, and predicting the prognosis. But here's the key takeaway. The treatment and prognosis often don't depend on knowing every molecular mechanism in detail. For instance, the cross-bridge cycle and sliding filament theory are models that help us understand the role of calcium and ATP in muscle function. While it's essential to know what happens when there are abnormal levels of these substances, you don't need to memorize every step in the process. So, when studying, always ask yourself, how does this information help treat a patient? Focus on understanding how an organ functions and how that understanding helps predict dysfunction. When in doubt, refer back to the learning objectives. They are your guide to what's essential. I'm looking forward to seeing you all grow in your understanding of clinical physiology. Remember, this course is about applying knowledge in real-life clinical scenarios, not just memorizing facts. See you in class.